This empty chair represents the addict who died today, not knowing recovery was possible.
Hi there, and welcome to a very special edition of The Empty Chair, Exposing Addiction. As you'll see, we're going to have quite a different format tonight. We have a live audience with us, and it's because the two guests that I have with me tonight have really promoted a lot of interest in the world of substance abuse and recovery. What they've shown is that local government can have immediate impact on substance abuse. And I'm just thrilled to have them both here, so I'm going to introduce our own Chief, Joe Solomon, and our Chief from Gloucester, Campanello. Campanello, okay. We'll get to it next time. So basically what I'm going to have you guys do is maybe just take a few minutes. Maybe you can tell us about the program you started in Gloucester. I know you've got a lot of media attention from it, and I know just from reading you've been probably pleased with the success you've had.
Yeah, we had 4 deaths from opiate overdose in the first 3 months of 2015, and so that called to action the entire community and sort of charged the police department with coming up with different ways in which we could address the problem. Historically, we always have attacked the supply side, and that's good work, and that needs to continue, but we were asked to come up with ways that we could attack it from the demand side as well, from the consumer base, so to speak. And basically, we came up with a 3-tiered approach, is that anyone who walked into the police station with or without their drugs would not be arrested, would not face any criminal charges. Instead would be fast-tracked into treatment, assigned an angel volunteer who would sit with them during the process so that they would not fear the process or become antsy and leave, and would be intaken right there and then into a treatment facility. The second tier was that we felt nasal Narcan was being manipulated once it was deregulated. It's no longer a prescription medication, and anyone can buy it, but we felt that the disparity in insurance was ridiculous. Our local pharmacy was having to charge $3 if you had insurance for a dose, $140 if you didn't. And we felt that money shouldn't stand in the way of someone and a life-saving drug. So we decided that we would pay for nasal Narcan for anybody who wanted it, not only someone who's suffering from addiction, but someone who's a loved one of someone who's suffering from addiction, that we would subsidize that cost. And the third tier was that, every police department uses federal and state seizure money. That's money adjudicated from criminal cases against drug dealers, basically. We felt that we could petition our local lawmakers and also our state and federal lawmakers to look into that seizure law and see if we could get some of that money earmarked for addiction and recovery, since it was coming right out of the pockets of drug dealers. And so the results have been, from the Angel program, as it's called, under the Gloucester Initiative, we've had 55 intakes in 46 days, all placed in treatment, no criminal charges. And we're starting to hear back from the first group that was put in. Majority are doing very well. And so, of course, yeah, we're pleased with that. It's a little early and a little too small of a group to make any judgments, but it's certainly been a success in terms of growing trust between that demographic and the police department in Gloucester. The second tier, the nasal Narcan, well, as soon as they heard about the program was heard about, CVS jumped on board, lowered the price of nasal Narcan for those without insurance to $25 a dose. Walgreens said, we're not letting CVS get too much of that, so we're going to lower it to even less than that.
Nice.
And we know where that comes from. That's not coming from the individual pharmacies, and we applaud the pharmacies for stepping up and doing that good work, but it's coming from distributors and pharmaceuticals who are recognizing that if they don't pay attention to what's going on, someone's going to come after them for gouging the price of Narcan. So we look to see not only Gloucester have a drop in price, but other communities and public safety. The price of Narcan has doubled since last year for public safety. And the third piece is we've had at a state level, we've had $100,000 earmarked in the state budget for our initiative and for at least two other police departments that want to be involved in this type of thing. And at a federal level, Senator Ed Markey has introduced two bills that deal with opiate addiction, one specifically for veterans and opiate addiction, and another that is more comprehensive.
No, and you should be pleased. And, you've had, I don't know how many, all the ones you've had that have gone in there, I'm sure you're aware that you're not going to bat 1,000. People go in, they come out, they relapse, they go back in and so forth like that. Getting them in there, being able to get them in the way you've been doing is a huge, huge plus.
And we don't make any judgment on anybody. That's an important piece of this, is that our job in law enforcement isn't to judge while we're doing our job. So we have had a relapse already. And the best part about it, we consider it a win, because instead of going out and continuing to use, that person used for about a week and came back in.
Wow.
And we got them back into treatment the same day. So we consider that a win as well. We
Yeah.
know it's a disease. We know the pathology of it is that relapse is a part of the disease. It's a part of the recovery, and that it's lifelong. You're only in remission. And we're committed to that, which is why we say, go out, do your best from this program. If you fall off the wagon, come back and we'll help you again.
Well, you don't know how happy it makes me feel to hear police describe addiction the way you just have, because I know it's been a drastic change over the years. So I do applaud you, and I obviously wish you continued success, and I know we'll be talking more about it. Chief Solomon, I know you just did some business similar, but you went through the mayor and the city council to develop a program that you'll be starting very soon, I'm sure.
Correct. And first I want to say what they're doing in Gloucester is amazing, and it's nice. Me and you have had many conversations how police officers have changed the way we think, and compared to 29 years ago, the way I was taught to think to the way I think today, it's a total change. We do in Methuen believe in the service part of it. We just never thought it was going to be this type of the service part. So if I could start about when we saw the big issues.
Absolutely.
November 2013, and I'd like to mention that we have Chief Patrick Keefe here from Andover. And back in November 2013, the chiefs, we talk in the Merrimack Valley, we go to lunch together. We got together and said, you know what, let's have a meeting, because we're noticing a major spike back then, the last couple of months before that, in overdoses. So we had Haverhill, Andover, North Andover, Lawrence, State Police. We all got together, we went to North Andover PD, and we had a DEA agent, and we had some cross-border initiative investigators. We sat there, and I think it was an interesting conversation, and it wasn't the typical conversation we have about what are we going to do, who's going to do the sting and go grab the guy, and who's going to go set up at this place. It was, can we try to figure out what the cause of this is? What's the root cause of it? And can we figure out how are we going to service the end user rather than the dealer? And it was probably the first time you had that many law enforcement officials from so many different groups and that many high-ranking officials in the same room as the street-level detectives. And the general conversation was, we're not winning what we're doing and it isn't working. We need to change what we do. So out of that came initial initiative to go out and hit the streets hard. Two parts: grab the dealer, grab the user, bring the user to the hospital. And we did start to learn at that part. We're getting to the hospital and we're getting them in and they're getting turned back out. And we were kind of spinning our wheels. And phone call came from you to me and said, hey, Merrimack Valley Prevention Substance Abuse Program, we just started it. It was a few months after this. We got together, we started attending your meetings. which I think was the next rung of our education, learning about the disease and that it is a disease, and that's how we talk about it in our department. We say it's no different than diabetes or cancer. It is something that is prevalent everywhere, and as we started doing the research in our own community, it wasn't the heroin addicts of the 70s. Typically, you saw on the side of the street shooting up. It was the opiate pill prescriptions. It was the doctors, the lawyers, the teenage kids, the athletes. So we started working with all different groups, and I think the Merrimack Valley Prevention Substance Abuse Group was the best group to team with, because we learn something every single month, and I think from our standpoint, it isn't what we go to the meeting to tell you. We go there, I open up my phone, I give you statistics. It's what the addicts in recovery, and the addicts and the parents have to tell us, and the signs and symptoms, not the medical signs and symptoms that we were taught, the signs and symptoms of the behavioral change that help us put that out. The next level step of that was to double the investigators in our drug unit for the purpose of locating users that we could help. And the following step was getting approval for Narcan. You might as well take my head and smash it on that table 100 times, because it was so hard to get emergency management on the state level to say, yes, you can carry Narcan. It took us a long time. They made us apply for a license. Then the next battle was training everybody and buying the Narcan. We started purchasing Narcan. I think the first group of Narcan we received was about $18. We went to repurchase, it was like $70. And then we're like, well, I can't afford to buy this. I need 200 doses. I can't go get $14,000. What am I going to do? So we formed a partnership with Holy Family Hospital, the pharmacist, and she said, you're not buying the Narcan today. I'll call you when you're buying the Narcan. She said the price fluctuates daily based upon the demand that day. So she started watching the prices. Oh, I got it for $40. Give it to me. So I can only get you 20. We'll take it. So we bought some at 40, some at 28, some at 21, some at 50. We kind of bounced around. We've kind of settled in that $23 range. And the challenge was, do we just put it in a cruiser, or do we issue it to the officers? Because if you start issuing to the officers, they're on a private detail. They're out of their car. They're carrying it on their body. They go into court. They have it with them. We decided to take the expense of not only training, but issuing it to everyone. And I have to say, I thank the mayor and the city council for approving because again, I have to get the purchase approval. We purchased the Narcan. We trained everyone. We got it out in the street. And we had it on the street before Methuen Fire, only because the Office of Emergency Management wouldn't give it to them because they're EMTs, and said, well, cops aren't as well, think of this, the cops aren't as well trained as you, so they can have it, but you can't have it. So it really boggles your mind how things change. Then Diana DiZoglio, Representative DiZoglio, and Senator Ives brought the Senate committee to Methuen, and we were able to talk to the Senate committee on substance abuse, and one of the first things we asked for was bulk purchasing of Narcan, and I'm glad to say as of the email yesterday, it's been approved.
I saw it, yeah.
As of this morning, there's no process involved. We talked about it with the chiefs. There's no process to buy it yet. And the second part of it was, and we also had the Speaker of the House at the state police station a couple of weeks ago, and both of those, the testimony in that conversation was, we need to amend Section 35 of the Massachusetts General Law. Under Section 12 commitment, what we're doing is, if you don't want treatment and you're in the crisis, we have to Section 12 you by saying you're not competent to make a decision because of your addiction. We want to amend Section 35 where a doctor, a nurse, or a family member can make a commitment for drug or alcohol to a police officer. I was told that bill has been filed and it's pending. So we may not have had such a widespread effect as Gloucester's had right now, but it's climbing that ladder and it's approaching it from a different angle. So as I learned, sitting with you guys, talking to everybody in the group, I started to think, well, I receive phone calls every single day from people that I know and people that I don't know, and just say, hey, what can I do with my kid? How about this? What can I do with my father or my mother? So when I started talking to your group, I hooked up with the clinical social workers that are there and the counselors, and decided to say, you know what? I think we need some clinical social workers, or we need some substance abuse counselors for the police. It's not a police function, it's a health department function, but we went headstrong. We went to the mayor. I asked the mayor, can I put this in the budget? He said yes. We justified it. Jennifer Burns, who's a member of our group, wrote me a job description. So we put in for 2 community engagement specialists that are going to focus on interacting with the people that are overdosing, community education, school outreach for the teaching part, and then running public events where we can train. And we got that approved, and within the next week or so, we'll be doing the interviews, and we'll have those 2 people on board. That'll be a great partnership to all these different groups, and hopefully they'll be able to assist the neighborhood communities in Merrimack Valley and be able to bring in intake from those other communities also.
And you know how excited I am about it. And when we read about yours, you know, I was on the phone to him the next day, and he had already started the process of, you know, going through the city council and the mayor. Folks, is up to this point, is there anybody that has any questions for either? And you next. Come on up, sure. Keep them kind of brief though, all right?
Hi, Paula Moore, and I'm actually from Salisbury, Mass. I wish we had chief of police like that, like you are. But my question is to the chief of Gloucester. You talked about this ANGEL program, and I have a 3-part question. What is it? Do you need training? And is there risk to being an ANGEL? Thank you.
Okay, well, first I want to congratulate Chief Solomon. I think every police department needs to involve a social worker or clinician in their department. I think we'll both agree that we neither one of us signed up to do this type of work, but the ball is being dropped on so many levels, and we have to see it every day. We have to see people suffering from this disease and dying. And so if we can lend our voice to the argument of what needs to change, I think it's important. So to get to the question, the ANGEL program is very, very simple. Anybody can do it. There's no risk to the ANGEL. We vet out the people that may be a risk, and we don't assign them an ANGEL, and we haven't had to do that yet, but we have a policy in place for it. No, you don't need any training, and we kept it that way purposely. There's so much overcomplication in the process of this disease. So our idea for the ANGEL was, you know, do you have a hand? Do you know how to use it to hold somebody else's hand? That you're an ANGEL. Because anybody can go into a hospital and read a book to someone who's in the hospital. Anybody can sit in a controlled setting, such as the police department or an emergency room, and sit with someone who's nervous, who's anxious, who's going through a process maybe they haven't gone through before, who was wondering what the next step is going to be, and simply talk to them or listen to them. It's just that simple. And our ANGELs are recovered addicted persons. They're members of the community who just want to help, and they're family members of people who are suffering or people who have died. We may find in the future that recovery coaches and advocates are a better fit, but right now we've gotten great feedback on the simplicity of the ANGEL program. So I hope that answers your question.
That's very good. Joe?
Joe Demore from Groveland. Chief Solomon, congratulations. I feel another editorial is going to be on the way.
Oh,
with your great work. Thank you. Chief Campanella, your program has a wonderful, compassionate quality to it, so it's very difficult to criticize. However, some of the concerns expressed by Essex County District Attorney Blodgett is that the drug diversion programs and the specialty drug courts already do a very good job in separating the dealers from the users. And there is a danger with the ANGEL program where people will game the system, will come through as hardened criminals, make believe that they want to go through rehabilitation, and then only to come out on the other end and reoffend. So you said that there's very little judgment, and with little judgment, perhaps you don't have the necessary safeguards. So ultimately, will you be able to do some statistics and data long-term to see what happens with the end result, people going through the system, to help, help assure that the system is not used as a great way to escape prosecution? Thank you.
Well, I think the concern is mostly based in myth. I don't think there are any people who are end users who are hardened there is a very small population of end users who are hardened top-level criminals. We do have safeguards in place. You can't enter our program if you have a warrant for your arrest. You cannot enter our program if you have at least 3 convictions, and one of them is a convicted distribution charge. And we have safeguards against danger as well. The concerns that were raised by the district attorney, and we always welcome his input, and he has our policy now in what we created. I think that the concerns we noted, we vetted it through our own legal process, and we're not backing down from the program. We think it's doing the right thing for the right people. We don't have that concern.
Okay. Thank you.
You're welcome.
Anybody else before I continue? Jessica? This will be the last question, then we're going to continue with these, and then we'll see if you have something else.
Hi, how you doing? My name is Jessica Finicaro from Methuen, and I've lost a few family and friends to substance abuse. And one of the biggest issues that I see, and I was hoping that you'd be able to address, is trying to convince people, and I saw this a lot when I worked at the state, that you won't face charges. And a lot of that needs to be marketed and explained to the community, because oftentimes there can be some distrust. If you know that you are using an illegal substance, what can you do and what are you doing to combat that issue?
Well, I can talk from our side, and I'm sure the chief can talk from his, but all his publications, all his press releases have made it very clear. In Gloucester, they're not going to charge you. And for us here in Methuen, there's the state's new Good Samaritan law. So if you are in possession for personal use and you're looking for help or you're overdosing, there's absolutely no charge. And if the person here is overdosing and a third party who doesn't even know them makes a phone call to help them, based upon the law, you're not going to be charged. So unless it's a distribution, you're not going to see that charge. And what we're finding out is even in the stings that we're seeing still occurring in the area, because you still have to have activity to defer the dealers, the user who's going to court is having the case diverted and sent off to some type of treatment, and then eventually having the case dismissed. So I think even the district attorneys are seeing it, and based upon the guidance that came from the state legislature and the governor when he signed the bill, that the Good Samaritan law now is saying if you're an end user and you're looking for help, you have an exemption to being charged. However, if you're still actively trying to buy and just take off, then you're subject to be charged. And I think that's where, at least in Essex County, the DA Blodgett's program works. Because if I just get a whole bunch of people who are buying one day, and we get you to court, they're getting into drug court, they're getting evaluated, and if they qualify, they're going into diversion and treatment. So I think even if you get charged, you're getting washed through the system for services. If you're being charged with distribution, you're going to be prosecuted to the fullest extent. But the chief, I'm sure, can talk about that.
And yeah, going back to the previous person's question about drug court and diversion programs, I think they're great for people who are charged. Some people don't do well in a coercive or forced environment. In other words, look at either get clean and go through our program, or we're going to charge you criminally. We didn't think that should be a firewall in terms of gaining services. So we took it a step further. Those who need to be charged need to be charged. And this applies to people that walk into the police department and ask for help. When you're on the street, all bets are off. My police officers use discretion in any case of drug use or possession as they would in any other case. This applies to people who come into the station and ask for help, things we wouldn't have seen or done anyway. And we've had, as far as the trust issue goes, so first of all, we've had the questions, what if someone brings in 4 kilos in a wheelbarrow and wheels it into the station? I said, fine, I'll take 4 kilos off the street and send the guy to the hospital. It's the same argument for the gun buyback program. We were paying people $50 a gun to come in and drop their gun off, no questions asked. Well, what if someone showed up with a tractor trailer full of guns? Are we going to turn them away? Are we going to arrest that person? The logic doesn't make sense. All we can do is extend the hand of trust. Before this program started on June 1st, I was worried about two things. I was worried we wouldn't have one person come in. I was worried we'd have 1,000 people come in. And you know, I told people, I said, this is a great way for us to extend the hand of trust to a demographic that we don't have trust with, you know, a suffering demographic that we don't have trust with. And I said to them, I don't think 3 people are going to come in. But I think we've shown that you can build trust again, you know, if you stick to your word. And we've been very vocal about that, both, you know, in all these interviews we keep doing it on our Facebook. And Chief Solomon's right. There are other great laws in place that build trust, and that's really where it starts. Is you have to someone has to extend the hand, and that's all we could do in this case, and it seems to be reciprocated.
Well, thank you so much, Chiefs, and maybe we could start here. There's lots of people in this audience, and I'm sure many will watch it online. Maybe if you could spread the word verbally to either 5 people you know, or share it on your Facebook or social media, so that eventually everybody will really know and finally believe that that is the case, and will be able to come forward, and we can help a lot more people. Thank you.
Thanks, Jessica. Okay, we're going to go back to these guys. I have a lot of people here from communities outside of Methuen, obviously, and obviously outside of Gloucester. And a lot of them are coming here because they've both heard about both your programs. Now, we've been fortunate in our community group, MVP ASAP, to partner up with the police, the fire, drug court, and you name it. And you're right, it's really worked good. You've been helping us, and I've been helping you, and the whole thing goes like that. We have people, especially, I have some good friends from across the border in New Hampshire. They're having a hard time. How can you guys recommend to them, I mean, how can they go about having their local government start taking a little bit more of a, I mean, I know you both said they're doing legislation, federal and everything, but we both know, you know, it's going to take time, and as a rule, by the time it gets passed, it's usually watered down and so forth like that. I appreciate all the legislation they pass, but you guys have made an immediate impact. What can you recommend to them or to your fellow police chiefs around the Merrimack Valley and beyond? You know, how can you help them maybe start the immediate impact that you guys have?
Well, you know, it's sometimes you can't make people do what they don't want to do.
I shouldn't have said that. As soon as I said it, I knew I shouldn't have said that.
So, interestingly, I know that we both subscribe to a very similar mindset. We have Facebook pages, we have Twitter pages. We have open engagement, and it's open engagement to, and I love the line the chief used about reaching a hand out, because truly what we're doing is, if you don't have the idea of, I still talk to chiefs, and I've traveled from New Mexico to Maine and helped them do a Facebook page to only go back and look at their Facebook page, and it's, we arrested Billy and Johnny and Gene and Smith, and that's all you see. You don't see no responses to questions. You don't see any communication. So how do you get people to communicate and outreach? Reminds me back to, and you'll remember this because you were involved in the city at the time, 1995, when a school bus driver gets pulled off a bus and beaten by some kids in our city, and one woman, who we all thought was crazy, Linda Susie, started yelling and screaming and standing outside with signs and talking on a megaphone. And basically, at that time, we told her to move back to New Hampshire, where she came from. But within a few weeks of that, I actually said that, but within a few weeks of that pressure, and that's how our mindset has changed. It's like, well, we can't have 60 people at the corner at night. Taking over the corner where we used to move the kids, who are now protesting us. The squeaky wheel gets the oil. So I say they have to go to their city council meetings, their school committee meetings. The biggest change I've seen occur the quickest in my city is PTO. They start yelling and screaming about a baseball field that isn't even a PTO issue, and it gets done. They yell and scream about painting lines on the street, and it gets done. It has to be community organizing right from the roots coming up, and people have to get out and make them do that. I know I have met some of the people from New Hampshire at our event last year, and I did the outreach that I said I would do, but I'm still sitting here today without any outcome on the other side. But chiefs like us, chiefs like Chief Keefe, we're doing that outreach to the other chiefs. We are talking to them. I offer myself to any meeting in New Hampshire if I'm available. I missed the one that was in Salem because I had to be out of town. We also have to make sure that visiting chief wants us in their community.
Yeah.
But
Yeah, he made that very clear to me.
peer pressure is great, but we have to respect each other. And if another community, particularly New Hampshire, doesn't want me in their city talking, and you know how I can talk,
Yep.
then I can't go. But I'm open to the invitations as long as the sitting chief will allow us in there. But I say to them, continue doing what you're doing. I've watched the Facebook pages of the groups that we met at our annual event, and that stuff is, even though they don't think they're being successful, I'm seeing it being successful. So you have to just keep yelling and screaming. That's my standpoint.
Now, you mentioned, I think, in your opening statement that you had a few other communities that you were working with also now, or did I miss something?
Yeah, in Massachusetts, we're starting to see a lot of interest in, so Methuen is a very different community than Gloucester, is a very different community than Arlington, very different from East Bridgewater, very different from a Brockton or a Newton or a Reading. These are just a sampling of communities that have reached out and had discussions. And I echo Chief Solomon's, offer that I'll go anywhere and speak about this. New Hampshire has a unique set of issues, but your police departments are trying very hard. I've had two of the major cities in the last week reach out and ask, what can we be doing? We don't have these centers like you guys have, and we don't have this and that. So the dialogue is at least starting, and the groundwork is being laid there as well. So I know that the police departments up there want to be engaged in this, it's fun. It's almost funny in a way that we're sitting here talking about what is overwhelmingly a health issue, and how far we've come. The chief's got 29 years on, I've got 25, and he's much older than me, obviously. But when we were shaking and baking at the beginning of our careers, it didn't matter who we were arresting, and we were very much taught the mindset that's different from today. And better late than never that science has come forward, and we have adopted the approach that it is a disease, and we can't arrest our way out of this problem. We're never going to. And we can be part of the demand side of the solution as well as the supply side, and it's work we should be doing. It goes to the basic foundation of what we do.
Yeah, and you're right, because myself and I know a lot of my friends in here, we've been, those of us who have been affected one way or another by substance abuse, we've been working on this for a long time. And I don't know if, people used to hear us talk, my daughter's a recovering addict, or this one's a recovering addict. But when the police, especially over the last 2-3 years, I'm going to say police, the legislators, and so forth, when they started coming out and talking about it, then people slowly very slowly starting to get the stigma away. But when the police start to take the side that they're really more sick than criminal, it's had a huge impact. I don't know if you guys may realize just how much an impact it has when your local police start to understand what substance abuse is, like you two obviously do.
I think we do. I think that it came as a shock to me at first how loud a voice law enforcement has in this.
Yeah.
Because here's the city of 27,000 people in Gloucester putting a Facebook post out that hits 2.5 million, and then another 25 million with shared views, and we sat there and went, oh boy, we just made a lot of work for ourselves. But I think it's the provocativeness of relatively conservative entities such as law enforcement taking a stance on a very social issue that is completely opposite of what historically has happened. And I think the best thing we can do is lend our voice to those who know what happens, to the recovery community, to those who are very involved. We can lend our voice in whatever capacity can be used to reduce stigma, to have a louder voice in the legislation, to finally get insurance companies and pharmaceuticals to take responsibility for what's been created over the last 50 or 60 years. I mean, this is the Exxon Valdez of the healthcare system, and someone paid for that mess, and someone has to pay for this mess. And if 4 out of 5 people who end up with a needle in their arm started with a prescription pill, then we know exactly who has to clean up that mess.
Exactly. Before I move on, are there any questions from anybody out there? We all set? Oh, I'm sorry, Doug?
I'm one of those New Hampshire folks. I'm Doug Griffin. And I just had a question. Do you have any people approaching you that are stuck in like the Suboxone treatment program that are trying to get off of it?
Yeah, there's 2 at the station right now, as a matter of fact.
Yeah,
I think we have to be really careful because we're not experts in the medical field by any stretch of the imagination. We passed the chief's exam. We were lucky. So
that was 29 years ago, though.
But you get a crash course education in this when you start looking into it. The Suboxone issue, the methadone issue, there are healthcare providers, there are medicinal people who really believe that medicinal programs are the way to go. Then you have a whole other set of people that say, no, long-term treatment is the only way to go, and receiving that on an ongoing case. We're seeing people present who are, heroin addicted persons, or now Suboxone dependent people. It's not an overwhelming majority, but there are a few people who have presented like that.
You do accept them, though. That's a great thing.
You know what? We accept them, but a lot of times the facilities won't, because what happens is sometimes they'll test positive for an opiate, and sometimes they won't. And if they get to the facility and they don't test positive for an opiate, they're out the door again. And then we're struggling to find them another place, which is, from a layperson's point of view, and it's not to say that it doesn't work for people, and I don't want to be, I don't want to be critical of anybody who chooses this route and decides it's a good route for them. But I don't see the substitution of one medication for another making a huge impact for a lot of people. And it's been around a long time, and and the epidemic is growing.
And they go on for years on Suboxone. They just stay on it.
So I know there's a lot of new drugs right on the horizon. There's Vivitrol that people are talking about that has its own problems. There's another one I can't even pronounce the name that has some promise. But I think it's up to there's this disease attacks you, as Chief Solomon said. It's a cancer, and you don't treat 2 people with the same cancer the same way.
Very well put.
You may need chemotherapy for 3 weeks and be done. You may need it for the rest of your life and be in remission. Or you might need a shot and you might need surgery. It's just that complicated.
Yeah, I'm glad you mentioned that, because with all the various treatments now, there's no one size fits all.
Not at all.
Thank you.
Thank you. Thanks, Doug. As I said, I've been doing this for quite a while, and there used to be a lot of, there's a lot of people out there who have their definition of what an addict is. And I used to get angry. I've gotten past that, because I understand some people are never going to change. But I've even seen to the point now where, to me, I'm sure you both, obvious, and any police chief from any city is a big fan of Narcan. But you realize there are people out here who say, and I love this, they say giving Narcan to an addict is going to make them say, well, I can get high, overdose, they'll bring me back and I can get high again. Those are the people, those are the types of people, the mentality of a lot of people that I've been dealing with over a long time. And I'm going to take a wild guess you guys have heard similar things with people.
The people say there's no such thing as a stupid question. Well, there's your example to make sure that isn't true. That's a stupid question. And I'll tell you why, for 2 reasons. Number one, we don't supply Narcan just to the addict. We supply Narcan to the loved ones who have to watch, who don't care if their person with an addiction is viewed a different way. They only know that they're dying on the floor in front of them. So if it's my kid, I don't care what you think about it. I'm gonna have that life-saving drug for me to save my child's life. The other thing is the mere notion that an addicted person may exploit the fact that we're providing nasal Narcan does not negate our duty in public safety to provide a life-saving drugs. We are not judges. We are not someone's keeper. We only have the duty to provide that life-saving drug for someone if we're able to do it, and that's our duty, and that's public safety's duty. So that question is very easily put to rest, and I love when people ask me that.
Good, I'm glad.
And right on that, I get that all the time in conversations, and one of the issues I get is, how come Methuen has, and I looked at statistics when we just got here, 2014, today, January to July 16th, 36 overdoses. 2015, 72, exactly double. 2 deaths last year, 2 deaths this year. But we had 2 deaths with double the amount of overdoses. So what I'm getting is, you've become a haven for users, because they'll buy their drugs everywhere and go, well, Methuen's had Narcan, let's go to Methuen because we can save, Methuen will save us. I was at an overdose of a young 21-year-old girl. It was her 3rd overdose. And she, when I asked her when she was going to stop, she said to me, when I'm dead. So we immediately had enough evidence to put her in Section 12. But I say to the people is, so see that man having a heart attack over there? You know what? He's 150 pounds overweight, and I just saw him eat a hot dog. I'm not giving him CPR. I'm not putting an AED on him. He deserves to die. And people look at me like, how could you say that? I go, then how could you say to us that we should let somebody die when we have a drug that can bring them back? And if we save, and I look at the Narcan, I don't care the cost. If you saved one person, it's well worth it. But unbelievable, as the chief just said, how about the family who has to stand there and suffer and watch their loved one overdose and die in the 5 to 7 minutes it takes us to respond if they have the Narcan to use it. But I'm amazed today, after how many people see how vocal we are, that people actually come up to my face and they say that to me. Now, it's not said anymore around the police department because they know what happens when it's said around the police department. But initially it was sort of, there was a lot of negativity to that initially. But out on the street, I get the questions all the time, and I give them the answer. I mean, how could you stand there and not do CPR to somebody? So it just seems like in today's day, how could someone ask that question?
Well, I wanted to ask that because I was kind of hoping I would get the reaction that I did from you, and I'm glad I got the reaction I got from you.
And it's an interesting point about the mindset in the police department. When we started this program on June 1st, obviously, you know, I had to sit down with our staff and our patrol officers, and I said the word junkie is no longer in our vocabulary. It will be met with disciplinary action if you use that word. And for a chief, you know, and I believe I get along well with everybody there, and they still like me. It was a provocative thing to say because you're telling them, you know, what language to use and things like that. But the officers at the Gloucester Police Department immediately jumped on board with that, and I think to the question of, oh, you know, the addict is just going to use it to keep on doing it, is if you recognize this as a disease, why are you asking those questions? So if 1 + 1 = 2, then that's the end of the equation.
Yeah, and I'm glad I'm glad the way you explained it, both of you. And I'm sure you're also as aware as I am that there will forever be people who will not call it a disease, will call it a choice or whatever like that. And unfortunately, some of those people will never change. But I'm going to tell you, what you two have done, and the police in general, with their shift in attitude, with the jails and the sheriff's departments, the courts, you are having a huge impact on the way a lot of people are looking at substance abuse now. And it's something that you two and everybody throughout the criminal justice system and the legislators for finally getting up should be extremely proud of, because you're having a huge impact. You people have done more in the last 3 years than people like myself and some of my friends over here have been doing for countless years, and you don't know how much it's appreciated. I know we don't have a lot of time left,
Can
but
we
I'd like
talk
to.
about community engagement?
No, please do.
Because it's interesting, as I'm sitting here and the question came, what can we do in New Hampshire?
Mm-hmm.
Well, we did our first event last year with MVP ASAP.
Right.
Community engagement, education, awareness. We're going to do it again this year in
Yes, we
September
are.
at the senior center. I don't know the
September
date.
12th, everybody,
September
senior
12th.
center.
That's another thing that can be done in New Hampshire and another community. You do the community engagement event. You bring in the substance abuse counselors. You bring in the different groups. It's hard pressed for a law enforcement or firefighter agency not to accept an invitation to that. And you go to your city councilor, you go to your mayor, you go to your school committee people. When you invite them, it draws people. And our program was extremely successful.
Yes.
And really, your program, we were just a guest there. We helped support it and fund it and get it to run, but it was the group's idea. We have another one coming. That is the way to draw everyone in. And ours is a Merrimack Valley
Yes, it
wide.
is.
We had people from all over the place, and we attended the one in Lawrence. They
Yes.
did another wonderful one aimed at younger kids. But that's another thing, and we need community engagement. I know Gloucester has the community engagement. We've been doing it with the Facebook, the Twitter, and one of the important things we see is the PSAs, and we do our own 1.5 to 3 minute YouTube videos. And I can put up a video to talk on this subject or on another subject, and in 6 hours have 14 or 15,000 views. I can put that exact post up in script, maybe get 6,000 or 7,000, because people don't want to go down 3 pages to read, but you spend 3 minutes saying it. That's something your groups can do too, and pump out there your own individual PSAs. But community engagement is the next outgrowth of everything that law enforcement, public safety, and private organizations are doing. Getting their community engagement going. And the last missing piece that I see is hooking the educational group. We need not just the school committee, the buy-in from the schools and the resistance of FERPA. We can't be involved because of federal education rules and HIPAA. Well, we can't be involved because we're not asking for people who are having problems. We're just asking for engagement. We're lucky enough we have a great superintendent, so our school engagement is good.
Yes.
As I've talked to other chiefs, they're having trouble drawing the school department in. And usually in our communities, they're bigger than the city agency, so they have a farther outreach. So I would encourage the school element to jump
You're
on
right, and you know, I know one of my biggest goals has always been on MVP ASAP was try to reach out to those, I call them public enemy number one, the parent. They're not my kid, me. That's what I was. We're trying to reach out to them, and we've been finding it very, very difficult. I mean, we've gone to a lot of forums, you know, and we go to task force, and whenever I'm on a panel, I'll always turn around and I'll say, is there anybody in here who hasn't been affected or who doesn't work in recovery? And I'll never get anybody to raise their hand. I know myself and Doug Griffin and Susan and Betsy Cody, parents of addicts that have lost kids. That's one of our major goals, and you know, hopefully, I think you guys are going to have a huge impact on helping us accomplish that goal too. But we only have a few minutes. I'd like to have you both, you know, just have a closing statement to wrap up, and then I'll let you guys out of here.
Well, I'm gonna do a plug for something that came out of Gloucester, which is PARI, which is the Police Addiction and Police Assisted Addiction and Recovery Initiative. It's PARI, PAARI, USA.org. And what it's designed to do is for those police departments in areas that may not have the support to start these programs, we're raising money, we're raising awareness to help these police departments get started on a program where they can attack the demand side of the issue. We're also connecting, as a clearinghouse, all these centers from across the United States that offer services to persons suffering from addiction. And the outreach from that particular organization, we're hoping to take statewide and nationwide. So if you get a chance, take a look at it. At least sign your name to support it. The more, you know, everybody knows now, the more Facebook hits you get, the more electronic signatures you get. Those are the signatures on
I'll
the
tell you,
referendum.
could you give it to us one more time, and they'll put it on the
course,
screen when it shows?
It's PARIUSA.org, which is PAARIUSA.org.
Thank you.
And we're connecting police departments like Methuen and Andover and Gloucester and Arlington and the host of others that are interested in starting this. They either don't have the funding or don't know what's going to fit for their community.
Mm-hmm.
Because I don't think either one of us is saying that our particular programs work for another police department, but there are all kinds of ways to be involved in this subject.
And like I say, the main thing is you're having an impact right now, and you can feel really good about that, Chief. You can feel really good. Joe?
Yeah, my biggest thing is that the government agencies that we all are and that we're all part of can't do this without everybody. It's really, we're just the mechanism. We're the way to get you into the system. We actually need the community to step out to us. When you talk the core of community policing in the early 1990s, 1992, the big spiel, and you look back at Sir Robert Peel, we're doing what the community can't do themselves, but we can't do our jobs without the community. It really requires community engagement. And it's that old, the MBTA saying, see something, say something. Well, right now it's see someone who needs help, speak out to that person. We need everybody to do that. We need the communities to look around. And when I have conversations with my friends and our larger group of friends, I say to them, when was the last time you looked in your medicine
Good point.
cabinet? And they're like, what are you talking about? Go look how many Percocets, Vicodins, Klonopins, whatever else it is you have that for some procedure you had or some stress situation you had, somebody died in your family, you got Xanax or Klonopin and you stopped using it and it's in your drawer, or you had the root canal and for some god-awful reason the doctor gives you 6,000 Percocets instead of 3.
Yeah.
Where is that bottle? And we do we take in
Yes, you do.
the medicine exchange. And I really think people need to look at that. And the other part I say to them is when you go to the doctors, you take your child to the doctor, be careful for prescriptions of opiates that are 4 days or longer. And we're routinely seeing it's a 6 or 10 day prescription. And from everything I've told, I'm no expert, you hit that 4 days and longer, you start that addiction process. Do not accept those prescriptions that are longer than that. If you get them, take the pills away and control the amount of prescriptions that your children have. And seriously, call us. Call any of us. Call Chief Keefe. We've all, from the chiefs, from the Mass chiefs all the way down to Essex County chiefs, isn't this not what we talk about at meetings? We're talking about the crime stuff here. We're talking about this here, and it's the whole meetings. So we're trying to be engaged with everyone. Please engage us.
Yeah, and I'm glad you put such emphasis on the community. Yeah, I'm very proud of the community group that we have. I hope Andover, North Andover, Haverhill, all the surrounding communities. We meet the third. Actually, our next meeting is the third Thursday of August down at the Methuen Senior Center. Would love to have all the communities coming down there and to have your involvement, to have your input. And, you're right. The only way you're going to educate people is by bringing you, the community, the legislators, local, federal, state, all together on the same page. And you might just start reaching out to some of those people who I thought were unreachable, and maybe they are. Folks, how about a little round of applause for our guests? And, I belong to a family support group, you're aware, because you let me have your place. But those of us in my group are very pleased and with the approach the police has taken, because you too, and anybody who gets involved in this, you're going to save lives. And you're right, on public safety, protect and serve. But you're going to save a lot of lives. You with your program and you with the program you're going to be initiating, and any other one who realizes that substance abuse is a disease and maybe it's health, but let's face it, you guys are on the front line, so you're going to see it. So what I'd like to do is I'm going to give you each honorary Circle of Hope. That's the name of our support group. And that makes you an honorary member of the Circle of Hope.
Thank you very much.
You don't have to come to our meetings. You're off the hook on that. Folks, thank you for coming. Guys, I knew this was going to be a special broadcast, and you didn't disappoint me, not even this much. I hope everybody got a lot of information from them. And these are two people I think you can reach out to in the future. Again, thank you. Thanks for coming, guys. And we'll see you next month on The Empty Chair. Thank you.